Hello everyone. I hope that you all had a nice lunch break, but hopefully after your lunch break you won't have a short nap during my lecture. Right, okay. Basically, I will talk about the principles of PETCT images and the CT-based attenuation correction codes. Then I will describe the artifacts related with the PETCT imaging, and then I'll summarize it by giving some recommendations to the technologists how to deal with these artifacts. Right, so PET-CT is a multimodality imaging that integrates functional PET and structural CT information into a single scanning session. Well, it's allowing an excellent fusion of PET and CT images and thus improving lesion localization as well as it's increasing the interpretation accuracy of PET scans from, according to the literature, from 91 to 98%, significantly affecting diagnosis and staging of malignant tumors, as well as localization and identification of metastases. Moreover, the advantage of this multimodality is the usage of CT data for the attenuation correction of PET images, rather than using the traditional transmission rotating rod source. As well as, and this actually will result in reducing the time by 30 to 40%, which will ultimately leading to a high patient throughput and low patient discomfort. Right, so in PET-CT scanner, the PET and CT tomographs are housed both in a single gantry, where the CT tomograph is fitted in the front of the of it, while the PET tomograph is fitted in the back of it. The state-of-the-art PET-CT scanners usually have a bore size of 70 centimeter and an axial length of 100 centimeter. The large bores has two purposes. First of all, it allows the usage of the immobilization devices like body molds, head casts, as well as it will accommodate large patients. Right, so PET-CT modalities can be used either as a dedicated PET scanner or as a dedicated CT scanner. For the CT scanner, okay, it can be dual or multi-slice, axial or helical acquisition mode, of course, with a different rotating speed acquisitions. For the PET scanners, okay, it can be acquired in a 2D or a 3D acquisition mode. Okay. Okay, using different types of detectors, such as, I won't go through the detectors a lot, just mentioning their names, which is bismuth germanate oxide, gadolinium oxyorthosilicate, or lutetium oxyorthosilicate, because I think someone else will, one of my colleagues, other speakers, will mention this in detail. So multimodality imaging is a significant achievement in the fields of oncology, nuclear medicine, radiology, and radiation oncology. Right, one main advantage of PET-CT modality is, as I mentioned earlier, that is the usage of CT images for the attenuation correction of PET scans. and this actually will lead to a better interpretation of the PET images. So the use of CT scan, it reduces the total PET acquisition time, enhances the accuracy of the attenuation correction factors. Well, concisely, upon the completion of the CT scan, the CT attenuation coefficient analogs to different types of tissue are mapped to their respective PET energies, which will create a PET attenuation correction map. A PET CT imaging protocol usually calls for acquisition of a CT scout scan first, followed by a CT scan and a PET scan. Well, the usefulness, the advantage actually of this CT scout scan, that it can be used as anatomical reference for the PET CT image interpretation. So the technologist should use the scout scan in order to define the starting and ending location for the PET CT scan. CT scans are usually obtained at 100 to 140 kVp at various amperages, depending on the imaging protocol. Patient emission data are acquired for 3 to 5 minutes per bed position, covering the area of interest. Reconstruction, as it's mentioned here, for the CT images is 512 by 512 matrix size, while the PET images are 128 by 128 matrix size. Okay, so upon the reconstruction, the PET and CT images are displayed side by side and fused image. This is the three of them. Right. Now, artifacts are most commonly seen in PET CT images are due to metallic implants, motion-induced artifacts, contrast media, and truncation. As I mentioned for the third time, I'll mention it for the third time, as these artifacts are caused by the usage of CT images for the attenuation correction of PET scans rather than using the traditional transmission rod source. Metallic implants such as dental filling, hip prosthetics, or chemotherapy ports, which they will produce high CT numbers and generate striking artifacts on CT image. And that's due to the high photon absorption. And this will result in correspondingly high PET attenuation coefficient, which will lead to misinterpretation of PET images. As we can see here, in CT image, you can see the metal ring. It's obviously pointed out, but with the corrected PET image, we can see that it shows like it's a high uptake of the radio tracer, which it shows like it's as if it is a focal nodule. While with the uncorrected PET image, we can see it as just a high background. Right, so the metallic implants are non-attenuated PET images that are used to aid the interpretations of these metal-induced artifacts. Not all metal implants produce false positive PET results. Okay, for example, like a high-density metallic implants, such as hip prosthetics. Okay, I'll show you here, so you can see it. Okay. Hip prosthetics produces a high CT number, okay, because of their high photon absorption. But at the same time, they are attenuating the PET photons, which will result in no emission in the PET scans. So when this CT it's no emission data in the region of the plant. So we will see it as a cold area. So when CT attenuation correction factors are being applied for that photopenic area, the PET image show a diminished tracer uptake in that implant. And as you can see it here, it's like a photopenic area in image A, but with the corrected PET image, we will see lack of radio tracer uptake. This is another one. As you see it, the hip prosthetic is causing, like as I mentioned, it's causing striking artifact in the CT image, and a high uptake for the corrected PET image, while we see it as just a low background with the uncorrected PET image. This is just to trigger your mind. The technologist now for the recommendations regarding the metallic implant. The technologist should ask the patient to remove all metallic objects before imaging. Must document the location of non-removable metallic objects to identify artifacts, such that we said about the dental fillings, if there is any, and hip prosthetic and others. Usage of the uncorrected PET images, it will be much useful in reporting the case, because you can compare the uncorrected with the fused image of the PET-CT. Right. We have two types of artifacts related to the motion-induced motion, which is patient motion and respiratory motion. For the patient motion, it leads to artifacts in the reconstructed PET images, as there is a difference in acquisition time of PET and CT. As we can see here, this is a CT image where the patient is being imaged, and then when the bed is being moved automatically from the CT gantry to image the patient now with the PET gantry, the patient, it seems that he moved his head, so we are having this artifact. Another type of patient considered to be like a patient motion artifact is talking, yawning, moving the chin a lot. It's considered to be one of the artifacts that it is actually changing a lot in interpretation of any PET image. This is a CT image. While we see the patient is staying still, but it seems that the patient was talking or yawning at that time of PET imaging. So, recommendation, again. To prevent artifacts due to the patient movement, the technologist should use head holders, fixation masks, belts, or cushions, and good instructions before a scan, so you'll avoid that the patient is moving their chin a lot during the imaging time. Regarding the respiratory motion, it is considered to be the most widespread artifact in PET images. okay? And this artifact actually it's occurring during because of the discrepancy between the chest position in CT imaging and the chest position in PET imaging. So, and that's because of the long acquisition of the PET scan. The patient is freely, is breathing freely. So the final image is the average of the breathing cycles. While on the other hand, for the CT scan, the patient is breathing at a specific stage cycle. So the common type of a breathing artifact results in curvilinear cold areas, and this artifact actually appears when the CT scan is being imaged or acquired at full inspiration. So it will result in a downward displacement of diaphragm because of the expansion of the lungs. This downward displacement causes attenuation coefficient in normal location of diaphragm area to be underestimated. And this is because of that. This is because they represent air rather than soft tissues. So this underestimation of the curvilinear cold area are being represented, as we can see in this image, okay, in the area of the lung diaphragm interface. Moreover, this type of artifact has a deep impact on patients with proven liver lesions. Well, because of the respiratory motion, the liver lesion can incorrectly appear at the base of the lung. So we will see it as a focal area of the lung, and this is referred to as what we call it misregistration of the lesions. As you can see here, the image of the PET, the corrected PET image, the focal area is showing as if it is at the base of the lung. And this is actually mimicking a lung nodule. While in the other one is without the attenuation correction being applied for the PET image, we can see it is at the dome of the liver. This is another example, again with the same thing. You can see the CT scan. For the CT scan, there is no, there isn't any problem, and it's showing a normal respiration cycle. But for the corrected PET image, it's showing again that the focal area is related to the base of the lung, while in fact all the nodules are belonging to the liver area. So the technologist, as a recommendation, the technologist must instruct patients about a breathing hold techniques before imaging in order to minimize artifacts, producing accurately determinate images. On the other hand, for the elderly and diseased patients who fail to sustain breath hold during actual scanning, several investigators proposed either respiratory gating or phased attenuation correction and respiration correlated CT PET, which can lead to a more precise lesion localization and quantification of activity. Contrast medium. This is another type of artifact that we are facing it a lot for in PET-CT imaging. Well, intravenous or oral contrast agents such as iodine or barium sulfate are administered to a patient in order to enhance CT images by delineating vessels and soft tissue. Well, in spite of the fact that this is considered one of the pros of the contrast medium, it causes conflicting on the PET-CT imaging, which I mean is that it can affect quantitatively and qualitatively of the PET scans. As they are, well, for a high contrast agent concentration, it causes a high CT, or it produces a high CT numbers and creating striking artifact in our images, which will then lead to a high PET attenuation coefficient and results in overestimation of the tracer uptake within the image, and finally, which we are trying to avoid as much as we can, is getting a false positive PET results. The severity of the contrast agent artifacts on PET images with CT attenuation correction depends on concentration of the administered contrast agent, its distribution and clearance, and then I'll explain it more in this area. Well, it's, for example, for the oral, the concentration of the oral contrast agent, actually it increases with the time. So because of the significant water reabsorption. So on the day of the CT imaging, we will see that we are having a humongous artifact in our images. So as a result, a high CT numbers of the residual barium, okay, overcorrect. And that's what, it's because of overcorrecting the attenuation of PET emission data. And this will mimic an increase of the tracer uptake and in our image, which will affecting the interpretation of PET-CT scan. CT with the intravenous contrast agent has a minimal effect on PET images. Yes, it's because of, as I said, from the characteristics that I've just mentioned. For the intravenous contrast agent, it has a fast clearance and dilution. So on the time of our imaging, the concentration will be very minimal. As you can see here in the CT image, we are seeing, again, it's very clear, very nice image showing a striking artifact. While in the corrected images, we are seeing like a very, we see an increase of the focal uptake within the body. And actually, for this image is the patient has an oral contrast medium a day before their PET-CT imaging. While for the intravenous contrast medium that the patient has had it just a day before their his or her imaging, we will see that the focal area is very minimal. The technologist, it's being recommended that the technologist should be aware of the patient's prior CT scan appointment in order to schedule the patient for the PET-CT imaging. Also, it is not recommended to plan PET-CT scan for patients who had undergone CT with oral contrast agent the preceding day, for the reasons that I just mentioned before. Now, for the final artifact, which is the truncation artifact. Truncation artifact and PET-CT occur when the field of the view of PET 70 centimeter is larger than the field of view of CT, which is 50 centimeter tomographs. In PET scanner, the patients are usually being imaged while their hands above their heads. Okay, but sometimes, according to special cases, the patient they have to put their hands at their sides, and this is what actually sometimes is causing the truncation artifact. These artifacts arise when positioning patients away from the in-plane center of PET-CT gantry or imaging large patients. Well, when the patient extends beyond the CT field of the view. So the extended part will be truncated. So, and consequently, it will not be represented in the reconstructed attenuation factor. So when when PET imaging is started, the attenuation correction for the corresponding region is negligible. PET scanned, as well as these, as I said before, these artifacts are being arise with the patient scanned with the arm down, like melanoma and head and neck indications. So truncation artifact introduces a bias on PET attenuation correction images that underestimate the standardized uptake values in these regions. And as I said, they produces striking artifacts at the edge of the CT image, resulting in an overestimation of the attenuation correction using to correct for the PET data. And as a result, it will lead to a false positive image. As you can see here in CT image, it appears the truncated at sides. And this is actually what we call it biased PET attenuation image, where you can see it because of the overestimation of the tracer uptake, it shows as a focal nodule. This is another case as well. In CT image, if you see the yellow image, again, it's showing us the truncated area. Well, for the gray one, as you can see, it's the CT image and it shows the truncated region. For the below one, the yellow one, is showing the truncated, adding to that the overestimation of the tracer uptake. So, again, the technologists should carefully position patients at the center field of the view with arms above their heads in order to reduce the truncation artifact. Also, using an algorithm will artificially creating and extending field of view of the CT, which matches the PET field of view. Then the truncated regions can be recovered at high degree. So that means you are like playing on the computer in order to get the missing part. Okay, to summarize what I've said previously, PET-CT modality increases the accuracy of diagnosis by combining anatomic information from the CT scan with the functional imaging, with the functional characteristic of PET scan. PET-CT images controls the limitation that can be happen in the dedicated hybrid PET imaging. By using the CT images, the CT scan for the attenuation correction of the PET images. and thus actually this will improve the image quality and reducing the patient discomfort and enhancing the patient throughput. This is actually what I want you guys, again, whatever we are saying, no matter what we are saying, at the end of the day, we end up with a technologist, him or herself, watching their education, watching their training, watching their professionality. So, a conversant, educated, and well-trained technologist can minimize artifacts with image acquisition in order to produce better quality of PET-CT images. Those that are reference, you are most welcome to copy it later for your own knowledge. And thank you for listening. That's all, folks.